Hello, it's Dr. Steve K from WellnessOne, and I'm going to go through what the Spinal Hygiene program is and why we should do it. I'll give you a brief overview of, what we have going on with our spine and why we should take care of it. So let's start there. You have 24 segments in the spine, and you have 3 curvatures. From the front, it should be straight, and from the side, you should have 3 natural curvatures, a lordotic curvature, a kyphosis, and then a lordotic curvature here. Those 24 segments should be moving freely. That's kind of the reasoning for doing the spinal hygiene, is just so you have good range of motion in there. As we age, a lot of times we start to get restrictions in our joints and things like that. So when we start to have those issues, we start to move less and we start to get degenerative changes and things like that. And that's exactly what the spinal hygiene program is about. And so it takes you through all of your range of motion. It puts stress on the joint where it's supposed to try to increase curvature. And it's just really good for it. So think of it a lot of times like when we are brushing our teeth, flossing, doing all those proper things so we don't get cavities. That's what you should be doing with the spinal hygiene exercises and stretches that I'm going to teach you today. I'm going to go through each one of those, brief overview with it, and then let you know if you want to take advantage of it that you can. So with that being said, a lot of times we take better care of our teeth just for the simple fact that we look at our teeth every single day. We either look in the mirror or something like that. But our spine is definitely hidden within. And so it's not reminding us that it's there, that there's degeneration going on, that there's, a whole lot of issues going on. And as we should, as we age, actually be able to age very well if we take care of our spine. We shouldn't be ridden with, all of these wheelchairs and stuff like that. We should be able to age really well. And the thing is, we are living longer too. In the 1900s, we only lived until 49 years of age on average. And now we're living well into our 80s. And so arguably, it's more important now to take care of that, just because we are living longer. You don't want to live 40 years and have this immobility and pain. So that's why we should really take care of our spine. And one of those ways is to do that through some home care exercises that I'll teach you today. So yeah, if you guys have any questions or anything like that, I'll have to walk up to the phone, the camera, and see if there is any questions. But I would like to answer any of those questions. All right, so with that being said, like I stated before, we have 3 natural curvatures that are going on in our spine, and we need those to be having those curvatures. And from the front, we should have it straight up and down. That is going to maximize the movement. That's going to maximize preventing degeneration. That's going to maximize any sort of pinching of nerves or dehydrating discs or anything like that. And so that's important to do that. And yeah, so a couple different things that we do with the spinal hygiene movement is moving you through all those ranges of motion, and then also putting you on some foam rollers, and those foam rollers are stressing the spine, putting the spine back into that proper alignment so it can be where it should. So let's get into some of those movements, and then I'll go through all 4 of those that we should be doing every single day. And once again, if you have any questions, please ask. So the first one is going to be just range of motion. It's just putting your spine through any sort of movement And so we want to start with the neck. And so all we do is go chin to chest. And with that being said, we hold that once we get to resistance, and we hold that for 10 seconds. And then you extend backwards. Once you get resistance, you hold that for 10 seconds. And then you do some rotation. Hold it for 10 seconds, and then you do the other way. And so every single day you're going through all of this range of motion. And this first one, it only takes a couple minutes of your day. And so then the next one you move on to is just lateral flexion, where you're putting your ear to your shoulder. You want to make sure that your shoulder is dropped down, not pulling up towards your ear. And you hold that one for 10 seconds as well. You can probably see a theme here. You're holding this for 10 seconds on every single one of these movements. Once again, making sure our shoulder is hanging down. And then that completes the neck part of it. And then the next part is going to be your low back. And so what you're doing on this one is having your knees slightly bent. And then all you're doing is flexing forward. And then you're making sure and arching your back. And then you're holding that for 10 seconds. And then the next one, you're putting your hands on your hips, and then you're extending backwards and holding that for 10 seconds. And some people are going to be hypermobile in their low back, so with this one, you just want to go to the point of either where you're feeling it, or if you feel like you're going too far or you're pushing your pelvis forward, then you stop there and you don't go any further. You don't need to stress it too far or anything like that. You don't want to injure yourself on that one. Then the next one is going to be placing your hands to your side and dragging your hand down. So this is lateral flexion, and trying to put a C shape in your spine, and then you hold that for 10 seconds. And then the other one to the side, and you hold that for 10 seconds. And that's good there. And then the last movement that you're doing is just rotating side to side. So you twist here. You want to make sure that your pelvis is straight forward and you're not moving that side to side like that. So you want to make sure and do that. And you hold that for 10 seconds. And then you go to the other side. So as you can see with these movements, if you take your spine through all of the different ranges of motion, you're going to be able to keep that range of motion longer. And if you're doing it every single day, you can see how that's going to prevent some of this immobility or even some pain from coming on, because you're taking your spine through full ranges of motion as we're going through this. It's keeping those discs hydrated. It's keeping everything kind of lubricated in there. So, all right. And then the next one, you do need some equipment for this one. And for all of this stuff, we have the Spinal Hygiene program. And so it all comes together. It gives you all of the instructions. It gives you this nice booklet that Dr. Tabor had come up with. It gives you all the information of why you should be doing it, what you're preventing, and gives you all the instructions for everything here. But you do need a 6-inch elastic band here for this next one. And what this is going to be doing is strengthening these posterior muscles, so our alignment from the side can help increase that lordotic curvature in the cervical spine, more so just bringing our head straight back and holding it above our shoulders. A lot of us have desk jobs, and so we're sitting in front of a desk or a computer for an extended period of time. Think of this like, we already know that sugar to our teeth is really bad for our teeth. Think of this, where we're sitting down in front of a computer. Think of that as bad as sugar for our teeth, but sitting for our spine is really bad for our spine, because it's just compressing everything. And a lot of us are doing that for 6-8 hours a day. So, and then it causes our head to have anterior head carriage, or maybe you're even watching this on a phone and you have your head pointed forward. So this exercise is really going to help for that. And so what you do is you make sure you're in proper alignment as much as possible, and then you place the band behind your head, and you hold your arms at 90 degrees, put a little bit of resistance there, and then you hold your head straight back. And then you hold that for 10 seconds, and then you relax for 10 seconds, and then you do that again, and you pull in your head straight back. You don't want to be doing extension or flexion with it, tucking your chin or extending your chin up. You just want it straight back. Hold it for 10 seconds, and then you relax, and then you do it for 10 more seconds. Especially when you're starting out, just do this 3 times. So you'll do that 3 times. Once again, you can see how once you get efficient with this, you can really do this fairly quickly. So that's number 2. It's easy so far, right? And this is just a 6-inch exercise band. It's nothing fancy. But once again, it does come in the kit that we have here. The next one is going to be a wobble ball exercise. So you definitely need this wobble disc or wobble ball, however you want to look at it. If you do have an exercise ball, you can use something along those lines. And for this one, what you do is you sit on this, and then what you're going to do is rock your pelvis forward. And then you rock it backwards, and you do this 10 times where you rock them forwards and backwards, okay? I do have a more in-depth video on this that shows different angles. It's just really hard to get a different angle without moving the camera all around here. And then you're going to go side to side. So you're going to shift your pelvis to the side and then the other side. And you do that 10 times. And then you're going to do some twisting, rotation and rotation. And you do that back and forth 10 times. And then the last one, you're going to do kind of a circle around that exercise ball or that exercise disc. And so you're just going around 10 times. And with this, when you're doing that, you're going to feel some pressure in your lumbar spine and your kind of SI joints. You're stretching that out, and you're controlling that movement. So you're also going to be stabilizing some small muscles down there, and so it's going to build stability in your low back. And it's really just going to stretch that out. It's going to get more concentrated movement in that lower back into the pelvis area, and just keep it moving as much as possible, because that's very important. Once again, to go back to that, just to keep things hydrated in there, keep the blood flow going to that area, and keeping that range of motion going on there. So yeah, that one, once again, doesn't take a whole lot of time. You do need this wobble ball to be able to do that. Some other stuff that you can do with this is just sit on it for 30 minutes a day. It's really good for your low back when you're doing that as well. Okay, so then this final one, this one does take a little bit more time, but it really doesn't take much effort at all. And so what you need are these foam rolls. And so they're about the size of our forearm, so you can use like a rolled up towel or a sweatshirt or something along that lines. And the idea of this is going to be molding that spine back into those proper curvatures. And so without showing you me, I'll show you me laying down with it, but you're going to place one up here, and you're going to lay on your back, and then one down at the small of your back. Let me get this stuff moved here. This is the fancy bag it all comes in. So you're going to place this at the small of your back, and then this one in your cervical spine. And all you're going to do is you're going to start off on like a bed, something soft, because that's going to help you ease into this. This can be a little much for your spine in the beginning, but if you start off on a soft bed or something like that, it won't be as harsh to your spine as just laying on something hard with it. So then all you do is you just lay here for 5 minutes starting off. And you do want to work up to laying on this for about 20 minutes. But yeah, so that's 5 minutes that you're laying here, a couple minutes for the other one. So you're only in the beginning adding about 10 minutes of something to your day. So then as we progress, we want to bend our knees and move to something a little bit harder and extend that time that we're laying down. So when you bend your knees, it puts more pressure on the low back and helps to encourage that lordotic curvature there. You can also get to the point where you're actually sleeping with these. That's just, like I said, it's really molding that spine into having the proper curvatures. And honestly, this will end up feeling really good eventually. So we just want to make sure and do this, like I said, every single day. We brush our teeth. Some of us exercise every single day. We eat properly, all these sorts of things to take care of our body. But a lot of times we're forgetting about some very easy, common sense, movements that we can do for our spine. So, yeah, I think that comes close to answering everything. If you have any questions or anything, or even want to know more information about our spinal movement program that we have, we do sell the whole kit with the instructions and all that for $97 currently. That's if you live local to Lincoln, Nebraska here. If you live out of state in the United States, we do charge $10 for shipping. So, yeah, reach out to us. We can put an order together for you if you have any sort of, if you want to purchase it. So, anyways, if you have questions, like I said, leave them in the comments. Let us know. I'll more than likely do a lot more of these. And so the more comments, questions, things that you give me, I can answer all those in subsequent videos or even live streams. But I do want to thank you for taking the time to watch this. I do believe this is very important for people to do. So it means a lot to me. And thanks, guys. We'll see ya.